Welcome to the new world of hybrid meetings. We're having a lot of fun here in the room, making sure this all works for the first time. So I appreciate all the assistance we've got this morning. It's much appreciated. But with that, I'd like to call this meeting of the Human Services Licensing Committee to order. The time is 8:31 a.m. Members, today we have two bills on our agenda, Senate File 254 and Senate File 469. And after we hear each of these, we are planning to move both of the bills out of committee this morning. And for the record, a quorum is present. And first on our agenda this morning is Senate File 254, authored by Senator Curran. Senator Abler, will you move Senate File 254 to be before us?
So moved, Mr. Chair.
Thank you, Senator Abler. Welcome to our committee, Senator Curran, and whenever you're ready, please continue with your testimony.
Thank you, Mr. Chair. I appreciate the opportunity to present Senate File 254 to your committee today. This is brought to me by the Hazelden Betty Ford Foundation. This legislation protects the public and those served by the substance abuse disorder treatment providers while reducing costs and saving administrative time for both substance abuse disorder providers and the department. The legislation provides an alternative licensing inspection process for substance abuse disorder providers that are accredited by the Joint Commission, and that they meet all the other qualifications, including being in substantial and consistent compliance with the licensing requirements. The provider must also maintain compliance with all licensing standards while under the alternative licensing. With alternative licensing inspection, the provider will be deemed to be in compliance with provider licensing requirements and will not be subject to routine inspections by the department. However, the department will remain responsible for investigating all alleged or suspected maltreatment, and the alternative inspection may be terminated, may be terminated if the provider fails to maintain accreditation, is found responsible for maltreatment, or has other actions taken against it. I want to thank the department for engaging on the bill. I know they'll have questions about the bill, and I'm committed to working with them to address any concerns they may have and find a solution that protects the public while streamlining and bringing efficiency to the current licensing process. I ask for your support for Senate File 254, and much like all other activities that I've been working on, anytime we can reduce the regulation means there's more time and resources available to actually provide treatment, and that's what we're here for. In every aspect, whether it be documentation that doesn't add value, or in this particular case, licensing. And so at this time, I'd like to have Jennifer Losey from the Hazelden Betty Ford Foundation explain the need for the bill. Thank you, Mr. Chair.
Thank you, Senator Curran. Welcome to our committee, Ms. Losey. And please identify yourself for the record and continue with your testimony.
Thank you, Mr. Chair. My name is Jennifer Losey, L-O-H-S-E, and I'm Vice President, General Counsel, and Secretary for Hazelden Betty Ford Foundation. I thank you very much for your time today, and to Senator Curran for authoring this important and innovative piece of legislation. Like I said, I am the Vice President, General Counsel, and Secretary for Hazelden Betty Ford Foundation, and I'm here today to speak in favor of Senate File 254. In my role at the foundation, I lead the enterprise-wide legal, licensing, accreditation, and compliance team. Hazelden Betty Ford Foundation is the nation's largest and leading nonprofit provider of comprehensive inpatient and outpatient substance use and mental health treatment for adults and youth. Headquartered here in Minnesota, we provide life-saving treatment in states across the country, both through telemedicine and on-site at our 17 locations. Hazelden Betty Ford also collaborates with an expansive network throughout healthcare nationwide, supporting access to quality behavioral health treatment in every state. Our organization also encompasses a graduate school of addiction studies, a publishing division, an addiction research center, recovery advocacy and thought leadership, professional and medical education programs, school-based prevention resources, and a specialized program for children grow up in families with addiction, a program that is now free to all children in America and whose curriculum is being made available internationally to even younger kids through our partnership with Sesame Street. As COVID-19 has ravaged our country, we have seen an increased need for both mental health and substance use treatment services. According to a recent survey by the Centers for Disease Control, almost 41% of people who responded said they had struggled with mental health issues related to the pandemic. Additionally, since last spring, we have seen a 14% increase in alcohol consumption and a 41% increase in binge drinking among women. Behavioral health providers are closing their doors. Health systems are reducing behavioral health programming, and recovery services are shrinking due to the economic consequences of COVID-19. Hazelden Betty Ford is on the front lines of responding to this epidemic for behavioral health during the pandemic, including through an expansion of mental health services and substance use treatment offerings in new communities, delivered in person and via telemedicine to people who need help. As both the services and the professionals at Hazelden Betty Ford are state regulated, oftentimes with widely variable licensing and certification requirements from state to state, we see and experience very different regulations and oversight. We support efforts for national standards of care and practitioner licensing, such as the bipartisan bill Senator Benson has authored in the Senate for Interstate Compact of licensed psychologists here in Minnesota. We also support efforts to improve quality through regulatory deeming for nationally accredited organizations, including the Joint Commission found in Senate File 254. We understand DHS had some questions about the bill, and we have committed to continue to work with them on details of this legislation. As background on the Joint Commission, it accredits many types of behavioral health providers, including substance use treatment providers. These standards were written to establish very robust expectations that focus on safety and quality of services, while leaving many specific operational details up to the discretion of each provider, so long as the overarching stringent standards are met. The Joint Commission always defers to and supports state-specific requirements and expects accredited providers to follow all applicable state and local laws, regulations, and standards. As an accredited provider, we are held to a much more extensive and robust process than state regulations in many areas, including safety, environment of care, medication management, and quality and performance improvement. And our experience across the states is that many state legislatures agree and have put in place some form of full or partial deeming status for nationally accredited organizations. This bill, consistent with other deemed licensing rules for Minnesota DHS licensed providers, would offer providers like Hazelden Betty Ford the ability to drive outcomes through consistent and quality-based oversight that Joint Commission and 245G provide without duplicating efforts and by eliminating administrative burden. The bill would allow us to deem into compliance with certain licensing requirements based upon our status and through regular survey of our Joint Commission accreditation. Nothing in this bill would preclude DHS from investigating issues that could arise out of one of our facilities. The bill does not create, but rather it would reduce the licensor regulatory burden by eliminating duplication of effort between the state of Minnesota and the Joint Commission. This bill could also entice other providers to pursue a Joint Commission accreditation, having the effect of raising the field of care in the state to the highest standards nationally, because the accreditation is quality driven. As the state of Minnesota looks to the future of regulating healthcare, particularly behavioral healthcare, creating and modifying current state regulations and statutes through telehealth expansion, interstate compacts, deeming and reciprocity will be key tools in the state's toolbox. The status quo in our field will no longer suffice. People with mental health issues and substance use disorders deserve quality health care and treatment for their disease conditions. And this bill is one step in the right direction to make that happen. Again, thank you, Mr. Chair, Senator Coran, and members for your time today. And I ask that you please vote in favor of Senate File 254. And with that, I'm happy to answer any questions that you have.
Thank you, Ms. Losi. Members and first of all, I should ask is, do we have anybody from the department that wants to comment before we go to additional questions?
Mr. Chair.
Mr. Burdick, welcome to the committee, and continue with your testimony or your responses.
Thanks so much, Mr. Chair and members. Matt Burdick, Director of State Government Relations with the Department of Human Services. Just briefly want to confirm that we've been working with the proponents of this legislation and are working through just some outstanding questions. Just this morning, they did share a crosswalk that compares our state licensing standards with the Joint Commission accreditation, which is something we had asked for. What we'd be looking for is what's the equivalency between those two standards to make sure that we are looking at really an apples to apples comparison. We also just want to be really clear about how and when the department does have the ability to go in, either from a health and safety perspective or from a payment policy perspective, just to make sure we do have the ability to regulate when that is appropriate. And actually, in existing law, there is some flexibility to do something similar to this. We have seen it being used very recently, but it's something that we are not, opposed to. We just really want to make sure that we have all the right pieces in place to make sure this doesn't take us anywhere we wouldn't want to be. But I think we feel like we can work with the proponents on this. So thank you.
Thank you, Mr. Burdick. Senator Eaton, I saw your hand up. Did he answer your question, or did I somehow take you down?
Thank you, Mr. Chair. He did answer my question.
Okay, thank you. Okay, I see Senator Abler.
Thanks, Mr. Chair. It seems like this is something constructive. What's the destination of this bill after where it's going today?
This bill, Senator Abler, is going to the Committee on Human Services, Reform, Finance, and Policy, something I think you probably know quite a bit about, so it's coming your way.
Oh, I think we've both heard of that one. Well, great. And so to Senator Coran and to the Betty Ford people, and all that, and to the department, there's got to be a way to streamline some of this stuff. So, let's keep working on this, and I think it's really positive, and it's just another way to use even some of the challenges of COVID to make the whole system work a little better. So good luck, Senator Coran, and and the advocates. Thank you.
Thank you, Senator Abler. Members, any other comments for the testifier or Senator Coran? And seeing none, Senator Coran, do you have any final comments?
Thank you, Mr. Chair. Appreciate everybody's comments and concerns, and we will continue to work on and make sure everybody is on board as we work out the issues and make sure it's fully clarified that the licensing does not diminish the agency's ability, but actually frees up resources throughout the entire process. If the COVID process and the rapid transformation of all business processes around us in every facet of our life, if we're not examining these issues now and the opportunity to free up vital existing resources so they're provided, or with a greater ability to provide care on the front lines, it should be our mission. If we do anything policy-wise for this session, these should be the areas we focus on. So I appreciate everybody's support, and would again ask for the support as you move and consider Senate File 254. Thank you.
Thank you, Senator Coran. And with that, Senator Abler, would you renew your motion to pass Senate File 254 and it be referred to the Committee on Human Services, Reform, Finance, and Policy?
So moved, Mr. Chair.
Okay. Thank you, Senator Abler. And again, members, Senator Abler moves that Senate File 254 be recommended to pass and be re-referred to the Committee on Human Services, Reform, Finance, and Policy. And with that, if everybody understands the motion, members, We'll move to the vote. All those in favor, please signify by saying aye.
Aye.
Opposed, same sign. Motion passes. Thank you, Senator Coran.
Thank you, Mr. Chair.
Members, next up, we have Senate File 469, and we have a nice list of testifiers before us for that. That bill happens to be mine, so with that, I'm going to ask Senator Abler to take over for just a second so that I can make the motion.
Thanks, and holding the now virtual gavel. You can see it there. Welcome to the committee, Senator Utke.
Thank you, Senator Abler, and with that, I would like to move Senate File 469.
And thanks. Do you want to describe it a little bit? And I think then we'll just change hats again, so I'll do my amendment. So,
Yes.
Senator Utke.
Thank you very much. And members, this is a very short bill, kind of to the point, and it deals with the background waivers associated with our background checks. This past early in the COVID season, there was an executive order that allowed waivers to go forward, and we have, with the waivers, been putting off fingerprinting for our background checks. And the concern is that when these executive orders finally end and we have to go back to basically catching up on all of these background checks, that the 60 days that's in law, in statute, is not sufficient. And so with this bill, we would extend the waiver to be for 180 days. And I believe we'll hear even here throughout testimony that may be a stretch because there are so many to catch up with or for. But with that, Senator Abler, I think we'll jump into the testifiers, and I guess at that point I can kind of take it back on this end. And first up that I have.
Oh, Mr. Chair.
Yep.
If I can just hang on the gavel a little longer, just to help people understand. I think if I can give you back the gavel and then do my amendment, so people could throw that into the discussion if they feel like it as well. But I also just wanted to comment as the momentary chair that this is a real problem, and the department has had many good intentions, but they're concerned about what happens when it ramps up entirely. So they've been trying to get things going, but there's just a real problem with sites. So, and so just so people know, you and I chatted this morning, and so I thought it made sense for you to conduct the testimony, and then when the vote comes up, then I'll just resume the gavel, just technically to move the bill. So, Mr. Chair, I yield the gavel to you. I'd like to offer the A1 amendment if I can.
Thank you, Senator Abler. Senator Abler moves the A1 amendment, and we have that.
And I can describe it, Mr. Chair.
Yep, we have that before us, and please, Senator Abler, describe what's included in the A1 amendment.
And so it just seems like there's a dearth. This is not a problem for Anoka County, but it is a problem for your neck of the woods, Mr. Chair, and so many other places, and even probably our county. But there's just not enough sites, and it's even curious if the vendor that's been hired has enough capacity to set up all these sites timely, and so they're accessible, and I'm sure that's what part of the testimony is going to be. So this amendment is intended to start the discussion about why does it have to be a DHS vendor anyway? And so there's all kinds of folks that do fingerprints that are quite credible, including sheriffs and police and probably other entities. And so I believe this is going to the Human Services Reform Committee as well. So along the way, I'd be happy to chat with the department and any advocates, but I thought the discussion was really important. And so this simply says that you can get your fingerprints at someplace that can do classifiable fingerprints, and like the police, et cetera. And then those could be passed on to the vendor. So that's the general idea, and I'm open to questions.
Okay. Thank you, Senator Abler. And just a little bit of clarification for our members. The next stop for this bill will be the Committee on Civil Law and Data Practices Policy, but eventually it will end up at your committee, Senator Abler.
Okay, perfect. Thank
So,
you. Thanks for the
members,
clarification.
do you have any questions for Senator Abler concerning the amendment? Senator Eaton.
Thank you, Mr. Chair. Senator Abler, is there a way that these places are certified, that they're reputable and that this fingerprints, et cetera, remain, this data remains protected?
think-
Senator Abler?
Thanks. Senator Eaton, it's a really good question. Assuming that the committee and this body is favorable to this idea, by the time things get sorted out, the answer will be yes. In my mind, the sheriff and the police know quite a bit about keeping things private. So it's a bit of a work in progress, but I think that's a really important topic to bring up. And this committee is where that discussion would start. So hopefully, and if you wanted to help me along the way, I'd be happy for any help you want to give there. But I think it's quite a compelling need. So that's the best I know.
Okay. Thank you, Senator Abler. Any further questions or comments for Senator Abler on the amendment? Seeing none, we'll vote on the amendment to make the bill complete, and then we'll start our bring in our testifiers for the whole bill. So all those in favor of the A1 amendment, please signify by saying aye. Aye.
Aye.
Opposed, same sign. Motion on the amendment passes. Thank you.
Thank you, Mr. Chair, and I'm glad this is going to the Civil Law Committee. That's where, this is the perfect place to get that dialogue started. So thank you, I really appreciate your support.
Yep, thank you, Senator Abler. Now we're going to go to our list of testifiers, and first up, I have Sarah Grafstrom, representing ARM. Sarah, are you?
I'm here,
There she
Senator
is. Welcome, welcome to our committee, and please identify yourself and continue with your testimony.
Thank you, and good morning, Mr. Chair and committee members. For the record, my name is Sarah Grafstrom. I am the Director of State and Federal Policy at ARM, representing over 200 provider organizations that provide mainly home and community-based residential supportive services to people with disabilities. Thank you for the opportunity to speak in support of Senate File 496. I know there are others scheduled to testify, so I will make sure to keep my comments brief. A couple weeks ago, I had the opportunity to speak in front of this committee and share some of the challenges our members have faced with the availability of fingerprint locations. Some staff driving upwards of 60 miles one way to complete their fingerprints, the extended time periods in getting completed background studies returned, some providers reporting wait times of over 2 weeks, and the workforce challenges we were facing prior to the pandemic, which have only been accelerated throughout this last year. Currently, home and community-based services have a vacancy rate of almost 20%. All of these challenges remain true today and are why it is critical that the provisions within Senate File 496 move forward. Our members fully support the need to ensure that our workforce is safe for the individuals that we are supporting. But last fall, we became concerned about the growing backlog for individuals needing fingerprints for background checks. The waiver of the requirement to have fingerprinting as part of background checks was crucial to the hiring that our members have done during the pandemic. In September, we were told that approximately 70,000 hires have occurred under this waiver. That number has continued to grow daily. We believe that it'll be physically and practically impossible to get timely approval for workers who were hired during the emergency order within the 60 days currently required under law. Last month, we learned that the number has now grown to over 115,000 individuals who will need to have fingerprinting background studies completed. Without legislative relief, it is unclear how all of those individuals will be able to have their full background study process through the system under the current allowable timeline when the peacetime emergency ends. The failure to fix this problem and provide relief will result in staff being disqualified from working simply because of system backlogs. Our members were facing a staffing shortage prior to the arrival of COVID. The loss of the workers we have hired in the past 10 months would be catastrophic. We support an extension from 60 days to 180 days following the end of the peacetime emergency to complete your full background study. We hope this extension will allow current staff that have been brought on during the pandemic enough time to complete their full background study without the risk of disqualification due to system backlogs. And with that, Mr. Chair, thank you for your time, and I'm happy to answer any questions you or your committee has.
Thank you, Ms. Grafton. I think, members, we will go through our list of testifiers, and then we'll come back to questions for any or all of them, as we may get some of our questions answered as we go forward. So with that, next up I have Ms. Best with the Minnesota First Provider Alliance. If you would, there you are. Please identify yourself and then continue with your testimony when you're ready.
Good morning, Mr. Chair and members of the committee.
First of all, sorry about that. I looked here and I introduced you as Miss, but Mr.
No problem. My name is Andre Best. I'm the Vice Chair for the Minnesota First Provider Alliance, a statewide membership association for personal care assistant providers. I'm also the CEO of Best Care, a PCA and waiver service provider. Thank you for the opportunity to testify today in support of Senate File 496, allowing a 180-day transition period for background studies when the peacetime emergency declared by the governor expires or is terminated. This is important because the 60-day requirement could result in people going without care and make the current workforce crisis even greater. For example, if an employee is not able to clear by the 60th day, they would be disqualified and unable to work without direct supervision. PCA services are provided in the service recipient's home, as we know, and the provider agency cannot practically provide the supervision. Therefore, the employee would not be able to work until the study had finally cleared, leaving the needs of the person requiring care unmet. With the backlog of employees who have been issued an emergency study and who will need to receive a fully compliant study, getting them all completed in 60 days would be next to impossible to accomplish. We know this because the Department of Human Services tried converting back to fully compliant studies in the fall, and we saw many issues. This took place on October 21st, 2020, and then we were reverted back to the emergency study process on November 19th, 2020. During this time frame, we saw many things. Many applicants were not able to complete background studies due to limited access to fingerprint sites. Some employees, as already was mentioned, were traveling more than 50 miles to get their fingerprints taken. Also, employees were having difficulty getting their fingerprinting completed during the 30-day window due to the backlog of people needing to get their fingerprinting done and the fact that sites were only operating a few hours a day, often by appointment only. It's important to note that when an employee is not able to get fingerprinted within the 30-day window, the provider then needs to initiate another background study and again pay the $20 fee. In these situations, this can result in providers paying multiple times for the same employee. When the reimbursement rate for PCA is only $17.80 an hour, this can put a financial hardship on already struggling providers. When we convert back to fully compliant background studies, DHS must make sure there are an adequate number of fingerprinting stations that will be operational across the entire state and give providers enough time to process background studies. We ask that you support Senate File 496 and extend the time frame for the transition from emergency studies to fully compliant studies from 60 days to 180 days. Thank you.
Thank you, Mr. Best. Next, I have on my list Ms. Krinke with the Minnesota Hospital Association. Good morning. Welcome to our committee.
Good morning. It's nice to see everyone today. My name is Mary Krinke, and I'm the Vice President of Government Relations for the Minnesota Hospital Association. And I want to start by thanking Senator Utke for his work on this bill. And, you know, in the healthcare space, we don't always agree with all the other stakeholder groups, and they don't always agree with us. But I think that this issue is so important because it crosses the whole continuum of care. This issue is important to the hospitals. This issue is important to the nursing homes. This issue is important to ARM and our assisted living. This bill is important to the PCAs. It's the whole continuum of care that has been impacted by COVID, and this waiving of the fingerprinting, and how do we start it back, and what is the time and the capacity that we need. And we really cannot get all of this done in the 60 days. The Inspector General at DHS said there are now over 101,000 individuals that have to get through this process. And I've been thinking about this. It's kind of like a funnel, and you have all these people that have to squeeze in, and they just simply can't get it all done in 60 days. Last week, we did a little research on this at the Minnesota Hospital Association. We went online and we researched the Gemalto contract. That's the private vendor, Gemalto, that has the contract with DHS. And we went online and we looked at all of the sites around the state. Now, pre-COVID, there were 83 sites in operation. Now, since COVID, there are now 58 sites that are in operation. More specifically, we looked at the hours of operations. There are only 8 sites statewide that have any operations outside of the regular business hours. And there are only 7 of those sites that have any weekend hours. So if you are a PCA or working at the hospital or working at the nursing home, and you're working a regular 8-hour shift, where do you find time? And if there's no hours on the weekend or in the evenings, it's nearly impossible, it can be impossible to get a time slot to get your fingerprinting done. Of those 7 sites that are open on the weekend, 3 of them are in the metropolitan area. So Minnesota's a big state geographically, and we are hearing stories of people, just as you've heard from others, who simply cannot get a time slot to get their fingerprinting done. I'd just like to point out one more thing too. The website gives you the address of the fingerprinting site, but it doesn't tell you what their capacity is. Is this a site that can do 100 fingerprints in a day, or is this a site that can do 10 fingerprints in a day? So it would be very helpful for providers if the website had the information on there about what is the actual capacity of the site that they're looking to get their fingerprint done. You really need to know how many they can do in a day in order to see where do you keep calling to get your appointment. So regardless of how this issue is resolved, it's probably going to take a combination of 2 things: increasing the capacity as well as moving out the time frame. We think 180 days seems like a good option, and we're supporting this bill, but it's kind of in play how many days you go out versus expanding the capacity. We think that the amendment, and I haven't had a chance to run that amendment past people, but we think the amendment of Senator Abler seems like at least one other option to look at as we think about how we can expand capacity. I would like to point out 2 other things as you think about this bill moving forward. The Minnesota Hospital Association has, for some time now, had some issues with the department's the Net Study 2.0 system. It is fairly duplicative of the professional licensing and background check that is done at the Board of Nursing and at the Board of Medical Practices. Both of those boards already require a criminal background check as well as a fingerprint to be done as part of professional licensure. These 2 processes need to have better streamlining and align better so that an individual doesn't have to get 2 sets of fingerprints. We really need to think about how we can move these 2 things together so it's less burdensome for employers. I also want to mention that in the governor's budget, there is a proposal to remove the background study fees from a statute and move it to a fee schedule operated by the department. They are recommending pulling out the fee structure, which is currently at $20 per background check, And they're proposing to move that away from statute and moving it up to $42 an hour. $42 for a background check. We're not weighing in on whether or not that's the right proposal or the wrong proposal, but I do think it has to come with better service from the vendor. If we are just paying more for getting the same thing, that is not a good approach. So if you're asking the provider community to pay more for a criminal background check and a fingerprint, it needs to be a better service. So we think it needs to move to an electronic submission, and that the fingerprint maybe doesn't have to be just with Gemalto. Maybe it could be done by a fingerprinting company anywhere in the country perhaps and sent into DHS. So with that, Mr. Chairman, we support this bill and look forward to working with you as it moves through the legislative process.
Thank you, Ms. Krinke. Members, next up I have Ms. Palin with the Minnesota Association of Community Mental Health Programs. Welcome to our committee.
Thank you, Mr. Chair and members. My name is Jinlee Palin, and I'm the Executive Director of the Minnesota Association of Community Mental Health Programs. And our association is a statewide association of 33 community-based mental health centers and programs, serving over 200,000 Minnesotans. Our member programs' missions are to serve all who come to us, regardless of their insurance status, their ability to pay for those services, or where they live. Community mental health programs are deemed essential community providers by the state of Minnesota and serve primarily safety net communities, including Minnesota families, children, and individuals who otherwise would not have access to mental health and chemical health care in the community. We serve clients with comprehensive integrated care and several other supports. Similar to those who have testified before me, I am just offering our support of Senate File 496 and also wanting to bring some of the mental health community's perspective and support to this as well. The proposal to extend the waiver for background studies by 180 days after the peacetime emergency ends is really critical for us. The ability of our providers to maintain staff to continue providing mental health care throughout the pandemic has been a really crucial issue. Our mental health system is facing a workforce crisis, and this has been compounded by the COVID-19 pandemic. This waiver has helped to relieve some of the staffing pressure and keep the provision of mental health care seamless throughout the pandemic. We are now aware of this backlog of over 100,000 individuals' background studies, and we're very concerned of the impact this could have on access to care to some of our most vulnerable clients and communities. We believe that we understand that DHS is working on this issue, but the system is not there yet, and we believe that we need more time. Extending the waiver by 180 days at the end of the peacetime emergency will provide the time the state needs to work through the backlog of issues and background studies, and therefore we support this bill and ask you to please pass it. Thank you.
Thank you, Ms. Palin. Next up, I have Ms. Matson with Care Providers of Minnesota. Welcome to our committee.
Good morning, Mr. Chair. Thank you, Mr. Chair, members of the committee. My name is Nicole Matson with Care Providers of Minnesota, today testifying on behalf of the Long-Term Care Imperative, which represents senior care providers in the state. The Long-Term Care Imperative supports Senate File 496, which offers a 180-day transition period for the waiver that modifies background study requirements for DHS providers. Our senior care members have been grateful for the flexibility that the background study waiver has provided throughout the public health emergency. This has allowed them to hire new healthcare staff and temporary workers with an emergency background study process, which suspends the need to obtain in-person fingerprints and enables them to get new workers hired into our settings as quickly as possible. Senior care providers face considerable strains to their workforce, and any barriers in their ability to onboard staff in a timely manner are significantly detrimental to their ability to provide care and also put them at a disadvantage when competing with other industries. Our members shared that delays in access to fingerprinting resulted in losing prospective candidates and negatively impacted their ability to bring on new staff during the brief period in which the department returned to requiring fingerprints this past fall. An extended transition period would allow additional time to process the fingerprint backlog and ensure adequate access to fingerprinting locations so our providers are not hampered by the inability to hire timely or get their current staff fingerprinted timely. This waiver is critical to limit potential barriers and give senior care providers the flexibility that they need to address workforce challenges.
Thank you, Ms. Mattson. Next up, we have Mr. Lips with Leading Age Minnesota.
Good morning, Mr. Chair and members. I'm Jonathan Lips with Leading Age Minnesota. Our organization represents assisted living providers, nursing homes, and adult day services programs across the state. Along with Ms. Mattson from Care Providers of Minnesota, I am here on behalf of the Long-Term Care Imperative to share our support as well for Senate File 496. I think many of the issues I had planned to cover, Mr. Chair, have already been addressed, so I'll just say briefly that our members and aging services providers support fingerprint-based background studies. That system has been working relatively well for many years. And we know, of course, that the state will and should return to fingerprint-based studies when circumstances allow. But for all of the reasons that you've heard today, members, that process is going to take some time. Just at the moment when the waiver ends, and all of the existing employees who have only had emergency studies, just at that point when they need to begin moving through the process, of course, all new hires across all of the background study types that are affected by this issue will need to be occurring as well. So that backlog will be significant. As other testifiers have noted, when DHS did temporarily return to standard background studies late last year, our members experienced all of the same access issues that Ms. Grafstrom and Mr. Best and Ms. Mattson and others have identified. And without convenient and reliable access to fingerprinting sites, our providers would just be severely challenged to retain their existing staff who have only had emergency studies and to hire new staff, which would exacerbate an already difficult workforce situation in the field of aging services. So I think I'll leave it there, Mr. Chair. We appreciate your work on this issue. We also appreciate very much the significant amount of time and energy that the Department of Human Services has spent listening to our concerns about this issue over the past several months. And thanks again for the opportunity to share our perspective today.
Thank you, Mr. Lips, and I fully understand what you're going through. I've been at the end of the speaking line before, and you keep crossing off talking points because it's already been covered, but you did a great job. We appreciate it.
There is a temptation to say ditto, Mr. Chair, but I tried to avoid that.
Thank you. And then next up, I have Mr. Walsh with Minnesota Adult and Teen Challenge. Welcome to our committee.
Thank you, Mr. Chair and members. I'm also representing MARCH, which is the largest professional association for substance use disorder treatment and recovery professionals in the state. And I just, first of all, here's a little new information is we've worked systematically with the Senate and the Department of Human Services to streamline processes and eliminate all unnecessary barriers to employment due to background studies for people in the substance use disorder field and in housing. And I just want to applaud the Senate and the Department of Human Services that we've actually made great strides in doing that. So just an example is that Minnesota Adult and Teen Challenge, we had 50 people facing disqualification that we could find no good reason, the safety to clients or otherwise, why they're being disqualified. We don't have any such backlog right now because of the reforms that were passed by the Senate. So thank you for that. And thank you to Don Davis and OIG at DHS for streamlining processes in the ways being considered right now by this committee. We have, just to give you just a quick glimpse, we're calling it the COVID check, the expedited price process has been working quite well for Minnesota Adult and Teen Challenge and other providers. And we do need more time. We need that 180 days before we return to regular process because of all the challenges of COVID. So I just want to echo and amen everything that has been said up to this point. And that increased access to vendors for classifiable fingerprints is going to further streamline and expedite these processes and eliminate those unnecessary barriers to employment for people in the SUD field and also in housing. So we both applaud and support your efforts to continue to do that. And it also buys some time, just in case the legislature chooses to reform background studies further, as testified by Gina Evans from Minnesota Adult Teen Challenge to this and other committees. So thank you.
Thank you, Mr. Walsh. And that ends the list of testifiers I've got, but where I think I'd like to go next is, I see Mr. Burdick is still with us, and this pop-up keeps covering up my part of my screen, so I apologize for missing out. Mr. Burdick, would you like to comment on what we've heard so far, or if you've got anybody else with you that would like to do that? And part of what I'd like to also hear is, we're talking about the time period. What do you think is realistic too from the department side?
Thank you, Mr. Chair. For the record, again, Matt Burdick with the Department of Human Services. And I apologize, you just are stuck with me this morning. Our colleagues are stuck in the other body. But I will do my best to represent our position. And first of all, I just want to say thank you for yourself and others who have supported this effort. We really do see this as a major issue that we need to collaboratively address. And so appreciate that. As the other testifiers have alluded to, time is one of the factors that we're looking at here, but there are several. The other, of course, being access to sites, and then just having the infrastructure in place to process studies once they start coming back in. And how do we do that in a logical practice? We are currently assessing what that would all look like, but we can almost guarantee 180 days is not going to be enough time. There was a number of different statistics thrown out, but our latest is 125,000 emergency studies will need to be reprocessed after the peacetime emergency. And so we are currently assessing what the timeline would be and if there is some kind of formula we can use, not knowing exactly when that emergency will end and how many studies we will have in place at that time, especially if the legislature is not meeting, so that we ensure we have adequate time to address this on the back end. We are also working closely with our vendor to talk about how and ensure we have enough sites. Part of the challenge, as is alluded to, sites tend not to be opened when there are not people to use the site. And so it's sort of a chicken and egg problem. So how do we get past that? Another challenge that we've come across is that state law currently allows us to only have one vendor in place. And so we'd like to explore some conversation about, in times like these, when we have unprecedented demand, can we expand the number of vendors? And I think that might get at some of what Senator Abler is attempting to accomplish with his amendment. Part of the challenge there is our system uses a scan-based system versus fingerprint cards. And so transferability there is a little bit of a challenge, but we think there are ways to address the capacity issue and would like to work with the legislature on that. I'd also just like to highlight the governor's budget has a number of items in it tied to background studies, several of which are related to federal compliance, which is just another wrinkle to this puzzle that we need to really be focused on, as well as the fee proposal that Ms. Krinke touched on, which is really about ensuring our background studies unit has the infrastructure in place to process these in a timely and efficient fashion, and to really make sure that's a good customer experience, as she alluded to. And then lastly, just want to briefly address the issue of background study portability that was mentioned briefly. I think that's a topic that's going to require a lot more digging into. It's a little bit more complicated than it appears on the surface. For instance, unlike the licensing board studies, we actually do what's called a wrap back, where we kind of do an automatic check on the back end. And so there are some nuances between studies that we really need to dig into before I think we can get too far down that road. But overall, would be happy to stand for any questions you have, Mr. Chair, and just again, really appreciate your interest and efforts on this and look forward to collaborating with the committee to address this issue.
Thank you, Mr. Burdick. And members, now we'll move into questions or comments that you may have for any of our testifiers or for Mr. Burdick with the department. And first up, I see Senator Abler.
Well, thank you, Mr. Chair, and I really appreciate the discussion. I also appreciate sitting in the sunshine, even though it's so cold outside. And actually, I see some kind of rays of hope in the testimony of Mr. Burdick. I see kind of an evolving understanding. He's the messenger, so none of this is about him, Mr. Chair. But I see an evolvingness on the part of the department where they were just kind of plowing ahead and like, well, we're out of time, we got to do this, and now they're even suggesting 180 days might not be enough. So with a tone like that, and I think this can be resolved. This is really a huge matter. And given that we're so interested in, safe staff, could actually, if it fails, could actually collapse the whole system if it doesn't get resolved. And I think that's really healthy. And I just want to echo the comments of Ms. Krinke about this capacity question. There's a site, but are they open and how many can they see? My amendment is just a way to open up that dialogue about a few more options. And we'll see if it works, but this is the time to be creative so I'm happy the direction it's going in, Mr. Chair. So thank you to the department, and I really appreciate the comments of all the testifiers. Thank you.
Thank you, Senator Abler. Members, any other questions or comments? Senator Eaton.
Thank you, Mr. Chair. My question is for Senator Abler. I'm wondering if he supports the ideas from the Hospital Association that since the nurses and doctors already have a background check, do we really need to duplicate that? Senator
Abler.
I would think not. I think it's a time not to duplicate. That was like one of the softest softball questions I think I've gotten. So yeah, so duplicating. Yeah, let's do that a lot and charge people more money. Oh, absolutely. I think there's no need to duplicate. There should be some way that the department can take into consideration what's already been done. And this wrap back business and all the technical business. At the end of the day, it's about, is this person safe to work with vulnerable adults or vulnerable children or not? And once that's been established, I don't think they should do much more. Thank you.
Thank you, Senator Abler, and I hope you hit it out of the park. But members, anything further? I'm seeing none. So Senator Abler, I'm going to turn it back to you so that I can make the motion.
Thanks, Senator Utke, and back to the committee. Do you have a motion for us?
Yes, Mr. Chair. I would like to renew my motion that Senate File 496 as amended be recommended to pass as amended and be re-referred to the Committee on Civil Law and Data Practices Policy.
Thank you, Mr. Chair. Is any questions about the motion? And I only have my little monitor, so if you have a question, just say something. Hearing nothing, all those in favor of the Senator Utke motion, say aye.
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 Opposed, same sign, or whatever sign you like. The motion prevails and the bill is re-referred. Senator Utke, the con is yours.
Thank you, Senator Abler, and thank you, members. That does conclude our business for today. So I thank you all for joining, and I also want to thank all of those in the room here, in our committee room, that our first meeting with the hybrid operation, and it worked very well. So thank you for all the effort that you've put in. And with that, members, we are adjourned.